Ask your doctor about. People have access to health care in America. They can just go to the emergency room. George W. Bush. Ask your caregiver why his fees must inevitably rise twice as fast as everything else every year. Talk to your doctor about his new cars, private planes, and royally spoiled kids at their finest schools. Have him tell you about all the selfless pro bono work he does for fully half a day, nearly every month. Get him to describe those usurious insurers and that fraud-ridden government Medicare system. Make him a list of the 300 conditions you may just have, but you never heard of before the glitzy ads. Let him explain why our medical system, second rate at best, is by far the costliest on the planet. Hear why practicing prevention instead of pay per service is the steep slope to socialism. Then learn how free market competition is the only route to a values-based universal health care. Ask your plastic surgeon about his solemn Hippocratic contribution to the betterment of our society. Have him explain why they need to make so much for sacred work they swore they would do for free. Ask for some of the free samples he sells and the kickbacks he gets from the Big Pharma salesmen. Just try to find out if your insurance covers something before both they and the doctor bill you. See if they'll tell you how much they make on every test they order, necessary or not. Ask why they need so much money for doing such noble, fulfilling, interesting, and useful work. Ask your doctor about the many physicians' lives that were shattered during the Great Recession. Get an explanation of how simply slashing benefits would reduce waste, fraud, inefficiency, and costs. Find out why life expectancy and infant mortality are worse here, even though we pay so much more. Be sure to internalize their gospel regarding faceless death panels and government grandma killing. But simply regard that we already ration treatment by pricing more out of insurance every day. Learn how simple tort reform and interstate insurance competition would surely make it all better. Make sure to proudly ignore whatever any and all irrelevant foreign countries do for their sick. Never forget that healthcare is an industry and, as such, does best without any government nannying. Universal access to doctors ain't even a constitutional right, but by our grace, you may go to the ER. Demand to choose your physician and cultivate that relationship, though he mispronounces your name every time. Be sure and learn about the wastefully socialistic consequences of some evil single-payer system. Ask your doctor how he rakes in so much, but contributes less to public health than any garbage man. Learn how specialist pimp perks guided the treatment referral he just wrote for you. Learn how $250,000 in education debt motivates him to provide affordable care for us. Study the ways their tax-deductible ski resort product seminars benefit healthcare consumers. Discover the dangerous public health menace posed by nurse practitioners and physician assistants. Realize that do no harm has been guiltlessly conflated with do nothing without their insurance card. Understand that the inability to find good BMW mechanics reduces practitioners in our rural areas. Become aware of the necessity of spending 20 cents of every GDP dollar on the healthcare vampire. Help your doctor preserve his right to focus on heavily advertised and high-profit mommy makeovers. Learn about the benefits of payment plan gastric bypasses over healthy diets and a little exercise. Ask how pushing cost increases onto patients could really end Medicare waste, fraud, and inefficiency.